Alright guys, we're in the last component of hip month. We're going to talk through external and internal rotation of the hip. We're going to do some stuff in standing, load bearing, and then some stuff in supine, non-load bearing, okay? The importance of hip external, internal rotation is that golf is a rotational sport. You have to be able to turn the hips, turn the upper body, lower body to move through. It's not like you're lifting bicep curls at the gym. It's pure rotation. And if you struggle with hip external, internal rotation, whether it's the trail leg or the lead leg, you might put load in other structures of the body, some that are not developed to take too much rotation, i.e. the lower back. Okay, so we're going to get Mark into a nice tall posture. We're going to take a look at multi-segmental rotation. So feet together, arms across your chest. We're going to turn to his backswing. He's a right-hand golfer, so turn to the right. The whole body, come, attaboy. And what we're looking for is, does his left shoulder cross his right shoulder? Yes, he can do that. If someone struggled, they might have stopped here. And we're going to ask him, is there any pain associated? No. So he's quite good with right multi-segmental rotation. We don't know where it's coming from, we just know he's good at it. Let's go to the left. Same thing with this. He goes quite well with his backswing. Typically, what you see right-hand golfers, they have a little less rotation on the backswing, a lot more with the follow-through. Come back out of there. Okay. So let's say he struggled with that. We're going to just assume it's coming from the hip for the next part. So I'm going to get you lying flat on your back there, Mark. Okay. And I want to see, for camera's sake again, take a look at the left hip. I'm going to passively take him through a couple movements and then actively take him through a couple movements. So going to flexion again, there, and then we're going to add on external rotation, which is me bringing the heel towards the midline. What we're looking for is probably 70 to 90 degrees, typical. He's probably at the 70 degrees, looking for any discomfort or pain. Okay, I can go a little further there. And this is 0, and then we look for internal rotation, which we're aiming for about 0 to 30 degrees. And he's at 30, any pain there. Typically what you might see is a little pinching in the front of the hip with individuals who are right-hand golfers on the left side here, because that might lead to hanging back in the golf swing. Okay, now I'm going to do that yourself now. Bring your knee to 90 degrees. He's got it there, hips there. And can you externally rotate? Okay. And then internal rotate. And if he's struggling with this, in terms of the degree of motion, it might be more of a motor control issue, because passively he can do it, but actively he can't. And we're going to try to find the reason for it. Sometimes it's something called labral tears or labral fraying. Sometimes it's the way his hip is shaped in terms of the femur and the acetabulum. Sometimes it's a lack of motor control or actual extensibility of the muscle, and that's where we come in, to find out what's causing it and see if we can improve it. Once he has no pain, he has good motion, then Mark comes in as a fitness professional to get that hip stronger in that rotational plane.